rerun for him. All right. So anyhow, so let's start again with the internal carotid. So the internal carotid, we agreed it's coming from the common carotid, and the common carotid it's coming from, it depends. Is it the left, is it the right? The left will be from the arch of the aorta, the right will be coming from the brachiocephalic. We're good? So here it is again. So here we have the internal carotid, right? Internal carotid, as it enters, this is the hole it enters, which is the carotid canal. You need to remember that now when we have the model in the exam, I can ask you what is that foramen and what passes through here. Now you know, right? So the carotid canal will allow you the carotid artery, the internal carotid, to get into the cerebrum. Are we good? Good. Then as it enters, then it's going to travel a little bit anteriorly, and then it's going to give you a small branch, a very small branch, and that branch is going to feed the eye, and that is called the ophthalmic artery. Ophthalmic artery. Are we good? Good. So the ophthalmic artery is coming from the internal carotid. We're good with that. Then, as I said earlier, we're going to just erase this part so it becomes a little easier to follow. This is the internal carotid being cut, and this is the ophthalmic also being cut. Sounds good? But you know where it's going. It's going to the eye. Are we good? Yeah? And by the way, it goes through the optic canal. It goes inside the optic canal, not the superior orbital fissure. It goes with the optic nerve. Okay? Right in the middle of the optic nerve, to be exact.
Central artery.
Yes, that's the central artery. Sounds good? Okay. So, then later on, what's left of that, after it gave the branch, it's going to divide into two major branches. We're talking major branches. One branch will go like this, and the other one will go like that, right? That is your anterior cerebral, and this one is the middle cerebral. So we have anterior cerebral, and we have middle cerebral. On the opposite side, we also have the common carotid here, and if you remember, also the common carotid gave you the ophthalmic, which we don't care about right now, right? And then it's split as well into giving you the, it's going to give you this guy and also that guy. So we have common carotid, ophthalmic, right? Anterior cerebral, middle cerebral. Are we following? Good. The right and the left, you remember I told you that we have to connect the two together in order to make sure that the blood will flow. Even if you block one side, then the blood will continue to flow. All right? Yes? Good. Then over here, I'm going to have a connecting branch between the two anterior cerebrals. We call that anterior communicating artery. That's an easy name. Anterior communicating artery. We're good? Good. Then do you remember something called a subclavian we talked about? Okay, so the subclavian, we have a subclavian here, and we have a subclavian here. So all the way down in your like upper thoracic region, the root of your neck, kind of. We're good? The subclavian, in addition to lots of branches, it's going to give you the subscapular, it's going to give you the suprascapular, it's going to give you lots and lots of branches in that region. But one branch is extremely important here, and that is called vertebral artery. The vertebral artery is going to climb up. Do you remember when we talked about your cervical vertebrae, that they had holes on the transverse foramina? That's for this. Right, for the vertebral artery and vein to go up in the transverse foramina. Sounds good? So we have a vertebral artery on this side, which again, where is it coming from, the vertebral artery? Subclavian artery, right? So over here, we're going to have another vertebral like that climbing up, and here is another one going this way. Sounds good so far? Good. Then they enter to the foramen magna. Remember, I hope you remember the foramen magna, right? And then immediately they will unite. They will unite around the base of the skull, right? The base. So they form what we call basilar artery. So because it's at the base, basilar artery, right? Let's review that part. So we have subclavians giving you vertebral. The vertebral is going up on the inside your transverse foramina in the cervical region, and then at the foramen magnum it's going to enter. As it enters, it's going to unite, forming to you that basilar artery. Are we good? So far we're good? Good. The basilar artery is going to give you lots of branches, right? It's going to give you some cerebellar branches. It's going to give you posterior cerebellar, anterior cerebellar, superior, inferior cerebellar. We don't have to worry about those branches. A branch for the midbrain, a branch for the medulla oblongata, a branch for the pons. It's going to feed those structures, but we don't have to worry about them. Sounds good? And even another branch that's coming from here that's going down your spinal cord. So you're going to pick the blood and go down to the spinal cord as well to feed the spinal cord. Sounds good? Okay. Let's focus on this part here. What did we form by the union of the vertebral artery? Both of them, what did we form? We formed basilar artery, the basilar artery. The basilar artery is also going to split into two branches like that. I'm going to just erase a little bit to give me some space here. It's going to give me the posterior cerebral. Remember, the anterior and the middle cerebral were coming from the internal carotid, whereas the posterior cerebral is coming from the basilar, which is actually the union of the vertebral artery, which is derived from the subclavian. Completely different origin than the common carotid. Has nothing to do with the common carotid. Are we good? Then let's link them. Then the internal carotid, which is right here, is going to communicate. It's going to have a communicating branch here between your posterior cerebral and your internal carotid. Here is your posterior cerebral. Here is your internal carotid. Before it branched, right, it received a communicating branch, and that's a posterior communicating branch. Remember, we had anterior communicating branch, and now we have posterior communicating. Sounds good? This circle here is your circle of Willis. Why do we have it? A, to ensure that the right and the left will get the blood, even if you block one side. And even if you block both carotids, you will still receive some blood from the basilar, which is coming from the vertebral, which both of them are coming from the subclavian, completely different route. Sounds good? So it creates an alternative route for you to get blood to your brain. Sounds good? Yes? Okay, we need to know the circle of Willis. We need to know how to draw it. We need to know how it's formed, theoretically, and also to be able to draw. Sounds good? Good. We're